Do you ever heard of music therapy? Music therapy is a clinical and evidence-based music intervention method that is used by trained clinicians who have completed a music therapy plan to accomplish personalized goals within a therapeutic partnership. The National Institute for Health and Care Excellence, also known as NICE, have claimed that therapies such as music therapy are an effective method in helping individuals who are experiencing mental health issues, and more should be done to offer those in need such types of help. Music therapy is appropriate for people of all ages. History of music therapy. In ancient Greek, the idea of music could affect health and behavior had been brought up by Pythagoras, Aristotle, and Plato. In the 1800s, dissertations on the subject published by American medical researchers included Edwin Augustus Eley and Samuel Matthews. In the 1900s, music therapy had formally begun after World War I and World War II. Music therapy has been used for veterans who are suffering both physical and emotional trauma. The National Association for Music Therapy, NAMT, was founded in 1950, while the American Music Therapy Association, AMTA, was founded in 1998. In the last 20 years, the New York City Music Therapy Relief Project was initiated in response to 911. Then, from 2005 until 2007, there were a lot of projects about music therapy that had been launched by AMTA. In 2008, AMTA took part in a historical meeting with practitioners working as therapeutic bedside musicians. So, how does music therapy work? As part of music therapy process, the therapist continually monitors, charts, and shares the progress of their patient. It is important they update the goals and objectives of the patient progress, working with family and doctors along the way to ensure that they are on the track to reach their medical needs. Sharing with family members allows them the opportunity to incorporate the therapy suggestions into the daily routines of the patient.
Next, how is music therapy used across lifespan? Music therapy is universal for people from all ages. For infants, music therapy before delivery promotes bonding between mother and baby and teaches techniques to reduce anxiety and stress. Music therapy improves physical condition of babies such as breathing, weight gain, and heart rates of premature babies. For children, teenagers, and adults, music therapy improves physical and psychological outcomes in people with serious illness. It can also facilitate positive changes in mood, self-esteem, and emotional states in teens. The emotional, expressive nature of music can be a bridge to self-awareness, insight, and recovery. If they have traumatic brain injury, music therapy can improve communication, mood, and motor skills in them. It also significantly reduces pain and anxiety during medical and dental procedures. The two common diseases, Alzheimer's disease and Parkinson's disease, which all age people are suffering, can also be improved by music therapy and reducing their depression too. People with Parkinson's disease and stroke demonstrate improved movement, speech, and quality of life.
What will music therapists do? Music therapists will assess emotional well-being, physical health, social functioning, communication abilities, and cognitive skills through musical responses. Design music sections for individuals and groups based on client needs using music improvisation, receptive music listening, songwriting, lyric discussion, music and imagery, music performance, and learning through music.
Besides, there are some ideas and interventions about music therapy.
Many effective musical interventions and strategies are uniquely designed to suit the patient's need. For example, patients who suffer from Parkinson's disease, singing works well for them as it can increase their speech volume and articulation, as well as swallowing function. While for patients who suffer from ADHD, music therapies play a beat with clear phrases the patient then echo to it. Patient was asked to listen, pay attention, and control their impulses. Draw what you hear is one of the music therapy activities that works well for creative expression. But this is more abstract and uses imagination. It's not suitable to use with patients who suffer from dementia. Let's listen to this music and to either draw or write out what you feel about it. Then share with your friends.
Next, we will talk about music therapy used in psychological and biological disorders. As you can see from the video, the autistic child seems to calm down after listening to music played by the therapist. Music therapy may help children with autism spectrum disorder (ASD) to improve their skills in important areas such as social interaction and communication. People with ASD are often especially interested in and responsive to music. This is because music is motivating and engaging. Music therapy can also be applied to those who suffer from schizophrenia. Listening to or singing songs can provide emotional and behavioral benefits for people with Alzheimer's and other types of dementia. This is because musical memories are often preserved in Alzheimer's disease. Even in the late stages of Alzheimer's, a person may be able to tap a beat or sing lyrics to a song from childhood. Music therapy can also improve symptoms of depression. Listening to music releases dopamine, which is a hormone that makes people feel good. Endorphins are produced too. They can induce happy moods and relieve pain. In other words, music therapy can help those with depression.
Next, I will introduce the Music Therapy Association in Malaysia. In the 1990s, a handful of Malaysians returned to their home country upon completing their certification as qualified music therapists. They embraced the diverse training backgrounds as well as application of a wide range of music therapy methods. They believe that this is an added advantage to our effort in pioneering music therapy in our beloved country. For example, the Malaysian Music Therapy Association, as known as MMTA, is the official resource and main body governing all matters relating to music therapy in Malaysia. Their president is Sherin Teh. She graduated with a Master of Music Therapy from the University of Melbourne. Their vice president is Gurpreet Kausee. She offers music therapy at her clinic in the Gestal Medical Centre in Kota Kinabalu, Sabah. They have many committee members and music therapists too. We can contact them through their email, which is stated on the website MMTA.
Next, we are going to talk about the role of music in promoting health and well-being and increased awareness among society of the importance of music in Malaysia. Music is more than just a form of entertainment, and there are lots of links between music and health as well as well-being. One of the ways are helping us to stay social connection with others. Music can stop you from feeling lonely or isolated. Besides, it creates an opportunity to meet new friends or people in our daily lives. Whether it's sharing playlists with your friends or meeting like-minded people at your favorite band's next gig. Music has the power to culturally, morally, and emotionally influence our society in Malaysia. It surrounds us every day and everywhere. Thus, music plays an important role in shaping an identities. Lastly, there are some interesting facts about music therapy. Music therapy is an accredited healthcare profession. The music therapy profession began in the 1940s when musicians were providing music for soldiers experiencing emotional and physical traumas. Since then, the field of music therapy has grown tremendously and requires schooling, training, and certification. To become a music therapist, one must hold a bachelor's degree, as well as complete a clinic internship followed by 1,200 clinical hours of post-internship work. Once completed, music therapists are eligible to sit for national board exam to become a credentialed professional.
I'm nothing special, in fact, I'm a bit overboard. When I tell a joke, you probably heard it before. But I have a talent, a wonderful thing, 'cause everyone listens when I start to sing. I'm so grateful and proud. All I want is to sing